In the wake of HIV and AIDS prevalence, coupled with armed conflicts in some African countries, children have been singled out as the most vulnerable group in the community. In Uganda, where children comprise up to 56% of the population, some children continue to live in conditions characterized by inadequate access to health services, biting poverty in homes, exploitation and violence. These living conditions undermine the four cardinal rights of a child to survival, development, protection and participation.
In the past, I think we had a problem of how communities relate with schools and also how schools relate with the communities. We have got the challenge of early marriages, defilement, and most of our girls who are in school, primary, as low as primary 5, are being married off. And these transactions, if I could use that word, actually happens in the community.
Upon this background, the Regional Psychosocial Support Initiative, REPSSI, in collaboration with UNICEF Regional Office for Eastern and Southern Africa, the University of KwaZulu-Natal and with the African Center for Childhood in South Africa, conceived and designed a certificate course to ensure that families and communities nurture, protect and empower children. REPSSI is a non-profit organization working to lessen the devastating social and emotional impact of poverty, conflict, HIV and AIDS among children and youth in 13 countries of Eastern and Southern Africa.
The certificate course we are running is aiming at skilling, the workforce, the social workforce that work with children and youth in ensuring that they access, services, especially in the area of psychosocial care and support, and also building, capacities of the social workforce, the community workers, that is at the community level.
In Uganda, the course started as a sponsored program in 2009 and was implemented by Transcultural Psychosocial Organization, TPO, a partnering NGO, before it was handed over to Nsamisi Training Institute, one of the government's top tertiary education institutions, to roll out the course in targeted areas.
Nsamisi was selected as such an institution that has the mandate and has the competencies and has the obligation to develop a curriculum that can address these issues, these problems that affect children and youth.
The course is implemented in collaboration with various NGOs found in 15 pilot districts in Uganda.
Originally, I think it was covering only 5 districts, and we have increased this number. As I talk now, we are covering 15 districts.
We looked at those districts that were severely affected by conflict and displacement, and also by the HIV/AIDS epidemic.
Kataku has been in the camps for some time, and in those camps, the trauma which was maintained in the camps is still running on. So as long as the program now came in, it assisted the organization in the community to synthesize the communities and to understand the issues of trauma. And trauma is one of the components in the training, which is in the psychosocial support issues.
The 18-month certificate course is designed for people working with children and youth. The students comprise community workers, community caregivers, program officers, teachers, police and social workers who work with children in various organizations in the targeted districts.
In the communities, we have contact persons who help us identify these students, and these are the mentors.
We do the mobilization for recruitment of those students from the district, but now we get them from different angles. Especially we look at those ones who are specifically doing the work of children from those organizations who are purely doing children's work. So we go to those organizations. They are the ones who nominate students who can be able to enroll for the what? For the course.
This course is based on modules. The whole idea about the modules is that it provides easy learning to students who are busy and cannot come to the institute to undertake full-time programs. And it culminates into the award of a certificate in community-based work with children and youth after 18 months.
Since the course started in Uganda, over 300 students have graduated and over 200 students are currently enrolled for Cycle 4.
We started with 56 students. That was in Cycle 2. In Cycle 3, we enrolled 94 students, and as I speak, we have 250 students who have been enrolled on the program.
As a result, the graduates have been able to professionalize the field of community-based childcare, mainstreaming child protection, psychosocial support, and community mobilization principles into their work.
There is a change at individual level, the way the learners handle children, they testify that there is a lot of transformation, because before they used to take it for granted, not knowing the children's rights, not knowing how to handle children. But when you talk to them, you get the feeling that actually there is a change. They testify.
Tom Angutoko is a project director at Ambiriambati Child Development Center in Arua district. He trains children in spiritual and physical growth, cognitive and social emotion skills so that they grow in a holistic manner.
I was looking at children as children, they cannot participate, they cannot decide for themselves and all that, but later on it impacted in my life. I was able to see that children are really very important. They can make decisions, they can participate. So my way of looking at them really changed.
For Lubowa Frank, the certificate enabled him to get a job as a social worker at Ekubo Ministries. Ekubo Ministries is a community-based organization in Mukono district that promotes the welfare of vulnerable children as well as resettling some of them in the community. The knowledge and skills he acquired have enabled him to engage with various people regarding children's rights and protection.
It was the very, very important certificate that led me to get this job in the first place, because they looked at it, it all had the components concerning the children welfare. And today I'm using the same skills to see that children are benefiting. Children need to be embraced whenever, when you're working with them, their rights should be protected. That one I never had it. That at least now I can talk with the parents that this is what the children deserve.
Florence Nanyonja is a teacher at Namiliengo High School in Mukono district. Apart from counseling, Nanyonja has used her skills to lobby a nearby church for a piece of land, where together with her students has established an Irish potato project to raise funds to buy scholastic materials and improve their welfare.
I selected some course units that I felt like they were of my major interest, and I looked at the community and the area where I work. They were of great importance and need, and those were children who are suffering under poverty, HIV, and those who are displaced, sometimes not purposely because of wars and quarrels, but some of the students were not satisfied with the places where they were living. Some of them were getting in from men to help them with the requirements. So we went to set up a small project. We had to plant some Irish potatoes, such that at the end we sell, try to get out some books, try to get out some clothes, get out some material for them, at least not to yearn for them, yet they cannot afford them from out. This is not only helping students in school, but even those who are in the church because of the child ministry.
Samuel Nsubuga is the Executive Director of Abana Community Care Uganda, ACCU, in Wachiso District. ACCU is a community-based organization that advocates for children's rights through child protection, inclusive education, social and economic security, and health promotion. Subuga is proud of the certificate course, which he says has enabled him to acquire skills to socialize with various people in the community.
I used the certificate as an added advantage to go and apply for a master's degree, and I've acquired a master's in public health. Also, it has enabled me to know how to deal with different problems.
Whenever I could go for interviews, it was that paper helping me to get jobs with working with NGOs, because I had now gotten experience and skills to handle the office and the families and even disabled people.
Lowly Child is an organization formed to respond to the conditions threatening the stability of children living in difficult circumstances. With the knowledge that I have gained from REPSSI, we shall be able to put in programs that can actually improve the livelihoods of families affected by HIV and disease and the entire community. And today, as we stand here, I got support from USAID and the US President's Emergency Plan for AIDS Relief Stream funding.
Before, I didn't even know how to manage myself. There are times when I could feel like life was not good for me. Like life was so challenging, but because of the course, I was able to know that even amid these challenges, I can be able to move on with life. And at the same time, know how to look after my children. So nowadays, I'm able to provide love for my children compared to how it was, because I used to fear parenting.
The impact of the course has also been felt in the communities where the graduates operate.
Children have now gone to the extent of engaging local leaders through debates. They engage them through radios, because we have Open for Us, where we have children talk shows. We take children, they talk for themselves. We don't talk for them these days. We have empowered the children to talk for themselves, which I think is a very big achievement out of the project.
Now we have these social workers who are trained in this course. They know how to approach the communities, sensitize them on the dangers of marrying off their daughters, and also to help them with referrals, whether it is medical or legal. They are able to do that. And now it is very easy for the school to liaise with these people who are professional in addressing these challenges. So that really helps the ministry a lot in achieving its objectives of retention of children, of creating a good learning environment for our learners, and also on improving the relationship between the school and the communities, the school and the parents. I think it is very positive, and it is really helping us in achieving our objectives.
I would request REPSSI maybe to introduce a diploma level program, actually, because most times there's a way most people they underrate. When you say that I'm a certificate holder, they really underrate it so much, though they can even see something good that you can produce from that certificate.
I think people these days are more aware of the issues of vulnerabilities, and quite a number of players are coming in game to support children that have gone through that, and also make sure that they put in place conditions that prevent these vulnerabilities. It is better than before in terms of response, but the need is still high.